Have you ever wondered when erectile dysfunction typically begins? It's a condition no man wishes to grapple with, but by the age of 40, it becomes a probable reality over the coming decades. Does erectile dysfunction worsen with age? It's believed that half of all men between the ages of 40 and 70 experience some degree of impotence, marking it as a natural part of aging. What triggers erectile dysfunction in older males? There's a wide array of both physical and psychological conditions that can lead to erectile dysfunction, irrespective of age. However, many of these conditions are more prevalent in older men due to deteriorating general health and heightened susceptibility to illness. Take cardiovascular disease, for instance, which refers to diseases related to the heart and blood vessels. Factors like smoking, obesity, poor diet, and lack of exercise can lead to cardiovascular disease, which often precipitates impotence by affecting blood flow to the penis through blood clots or the hardening and narrowing of arteries. Diabetes, another common cause of impotence, affects a majority of people between the ages of 50 and 80 in the UK. When poorly controlled, diabetes can damage blood vessels and the nervous system, affecting blood flow and reducing sensitivity in sexual organs. Neurogenic conditions, diseases that impact the nervous system, can also lead to ED. These include multiple sclerosis, Parkinson's disease, and stroke, which typically develop in middle age or later. Psychological conditions, such as depression and anxiety, can also cause impotence, as can certain medications used to treat these conditions. Emotional issues within relationships can also contribute to erectile dysfunction. On the topic of medications, there are several that can cause ED. Older men are often more susceptible due to their higher intake of prescription medicines. Drugs that can cause ED include diuretics, beta blockers, and antidepressants. Despite the age group, treatments for erectile dysfunction remain largely the same. The root cause of the ED is targeted, and PDE5 inhibitors such as Viagra are often prescribed. However, as one ages, maintaining good health becomes increasingly vital. Lifestyle changes like losing weight, exercising, quitting smoking, reducing stress, and cutting back on alcohol can prove helpful in improving general health and consequently resolving erectile dysfunction. Older men should be aware that certain medications can negatively interact with Viagra and other ED tablets. Viagra can also pose risks for men with cardiovascular disease. In summary, erectile dysfunction is a common condition that affects many men, particularly as they age. It's caused by a variety of physical and psychological conditions and medications. However, with appropriate treatment and lifestyle changes, it can be managed effectively.